I want to give a shout out. As you probably noticed at the beginning, there's some elected officials here who will be joining us later. We have some folks from the nonprofit sector. We have some community members. We have even some police members. I believe Curtis, who's the president of the Edmonton Police Association, local, is here as well too. And so we really have a diverse audience here who's hearing this, which is really, really important. And I thank all of you for coming. And I really believe that if we do our job together as civil society in preventing violent crime, it'll make it a lot safer and a lot easier to take the burden off the police forces and everyone else who deals with trouble as a first responder. And I think all of us here tonight have so much common cause in making sure that every single dollar we spend, whether it's on healthcare, education, prisons, or policing, is securing the best return on investment in terms of keeping people safe and ending violence. And that ending violence piece is really the piece that Dr. Waller zones in on, why I loved his book and why I was so excited that we could bring him to the Edmonton community.
You're going to find out I can't speak at even half the speed that Michael can speak. So please be patient. I really do want to recognize how wonderful it is to see Kate Gunn again. Kate was very definitely the catalyst in making Edmonton and ultimately Alberta a model for other jurisdictions in North America and putting us ahead of Western Europe. You're going to hear a little bit about how sad I am that is no longer true, but I remain a major, major fan of REACH Edmonton and everything that Jan has done to make that a reality. So you've heard that I come at this from a victim perspective, and this is a deep passion. I am too old to be here, and I'm only here because I think there is a chance that Canada can actually do things to meet the fundamental rights of victims. And I'm not talking about what Bob Lunny did as a remarkable police chief in Edmonton to start better services and responses to victims. A model for the world that the RCMP is about to adopt. I'm not sure exactly how, well, 40 years later. So you've been a pioneer of some wonderful things. What I'm talking about is the fundamental right to stop the actions that will lead to violence, that will lead to injuries, trauma, and occasionally death, and contribute to fear, and contribute to policies, particularly in countries like the United States, that are going in completely the wrong direction. So I want to start with a very short video of the mother of a victim of a random attack in the TTC in Toronto.
I'm not doing this for me. I am partly doing this for Gabriel, but really I'm doing it for change, for the one word change. This has to stop. I feel like we can do better. We need to start talking about violence, but the root causes of violence. I know it comes down to the social determinants of health. It's not an easy solution. We're not talking about adding more police force. I'm not talking about locking people up. We're talking about what are the root causes? Why is this happening? Why is a person homeless? Why is a person not being able to access care, access supports?
So I know you weren't able to read the bullets, but the titles are very important. And you have each of those titles here, and you have the bullets under here. And if at any point you wanted to check any of the statements, you wanted to see the reference, the sources, if you want to see the footnotes, about half of this book is footnotes. And I'm not sure whether Dan would read the footnotes, but I don't expect you to read the footnotes. This book is written so that you can read the introduction and conclusion and get the main message. You can read the introduction and conclusion from each chapter, and then if you want to, you can set up the PowerPoint. You can go back and look at details. Most of you will not need to look at those details, but that's how it was written. So now I'm going to take you through in rather more slowly, not at Michael's speed, what was in that video. And I'm going to be adding some other things that are important. But overall, I'm here because I know from looking across the world at what has worked, including what is known to have worked in Canada, what is known to have worked in the United States, what is known to have worked in England and Wales, that we can reduce street and gender-based violence by 50% within 5 years from when you decide to do it. Okay, so that's the title, but the subtitle is probably more important. 50% less violence by 2030, but I'm going to be arguing that Edmonton and Alberta, and actually Canada, could reduce street and gender-based violence by 50% within the next 5 years. Now, obviously, this depends a little bit. I met with the Premier of BC. He only has 14 months left. I don't expect him to start those things until after he's re-elected, if he's re-elected. So you have to add a little bit to the 5 years because of the election cycle. But that overall conclusion is important. This is affordable, it is doable, it is proven. We need to get to doing it. So what is the book? The book it's actually my third book around violence. Kate Gunn talks about Less Law, More Order, which was my first book after I basically got out of being in a semi-government or government role. I wrote another book on smarter crime control, and then I've turned to Science and Secrets. And Science and Secrets is because there's some science, and then there's some secrets to getting that science used. So the science, it's incredibly important. This is solid science that anybody who is reasonably good at analyzing what is available through government sources on the web and looking at governmental commissions making recommendations. If you are able to do that, and not everybody in this audience is able to do that, so what I did was I did that for you. I looked at all those sources of knowledge, and I'm going to talk about that a little bit more. And I was looking for things that work in the short term. 50% within 3 years. 50% within 3 years. So this isn't ending homelessness. This is not eliminating poverty. This is not the necessary things on reconciliation. These are things that you can do that, yes, are generally investing in the futures of young, disadvantaged men that will make a significant difference to violence. So it also looks at the general social safety net, and I'll come back to that. The secrets are how you apply this. And the international guidelines, if you go to what Canada approves in WHO or the UN Office on Drugs and Crime or Habitat, those guidelines are there. And a key to them is having an office that can diagnose, plan, implement, and evaluate. We can also learn from cities. You're going to hear me talk about Glasgow. You're going to hear me talk about Boston. You're going to hear me talk about how the Glasgow model is being spread across the United Kingdom by a conservative government and evaluating outcomes. We have to move from projects to enough sustained, smart investment. You can't stop gangs and guns in Edmonton with a project that only addresses 75 people. You've got to start talking about thousands. Thousands. And thousands aren't necessarily unaffordable. They're not unaffordable, and we'll come to that. You also have to train the people who make this happen. And in cities like Edmonton or Calgary, but also in the provincial government, and frankly, also in the federal government. And yes, you have to make lives. Now, Michael talked about costs. I'm an economist originally. Costs are important. Jan talked about 1 for 4 or 1 for 10. Well, I'm able to talk today about 1 for 30. For every dollar you invest for a Canadian proven strategy called SNAP, you get $30 in savings. These are now huge savings. But I'm not here just to get your taxes better used. That would be nice. I passionately believe that we have to stop the harm from violence. That's why I'm here at my age with you today. And by the way, that's what I was here for 15 years ago. Now, we also have to learn another secret, which I learned from why Alberta moved from being a leader back to business as usual. Or not totally, REACH is still here, but more or less to business as usual. And that is, you have to show results. You have to show results, and you have to enable people like Andrea, mothers, and I've worked with many mothers of murdered children. I've also worked with mothers where their kids are going to jail for murdering or for assaulting or for using guns. And those mothers want change. They don't want their sons in prison. They don't want their sons hurt, and they don't want their sons killed. And they are an incredibly powerful group and have been very powerful in making some of the change that I'm going to talk about today. So this is my bottom line, and I'm going to talk about accelerators. It's a UN word. What it basically means is you can't get these things to happen unless you invest in change. And investing in change is not just doing the things that work, it's creating the culture so that those things work. So it's having a violence reduction unit. REACH, in my view, is on the way to being that, but we need more than that. We need that in government. Alberta had that in government for 6 years. For 6 years. We need the training so that people can do the planning. We need data, data, data. Part of REACH Edmonton's mandate is data. Some of this is police data. Some of it is survey data. Some of it is data of people going to hospitals, because people go much more to hospitals than they do to the police, and you get much more of the context when you are actually collecting data in hospitals. So you could collect that data at the police level, but then you would miss out almost totally on sexual assault. So you have to have a number of different sources. And we need to raise awareness, and the police are key to doing that. I just did a presentation to city councillors in the Victoria area, and an inspector got up from the Vancouver Police Department, and he made a more passionate speech than I'd made about the importance of stopping young men from coming into the system. Because the system, yes, there are things you can do in the system, but you can do way more before, and you can do way more for victims, you can do way more for those young men. So I'm going to talk about 5 programs that have worked. I won't actually go into all of these, but these are things that we know that have worked. Outreaching to youth. 60% reductions if you use the British Youth Inclusion Program, which was used in Glasgow. Maybe between 40 and 60% if you use Cure Violence, which is an American program. I'm going to talk about SNAP. It's my favorite program because it was invented in Toronto, and it's being used more in some areas of Florida than it is here. This is just crazy. You have a program that gives you a $30 benefit for every dollar invested. developed in Toronto, and we're not using it. We are using it a little bit, but a little bit doesn't stop violence at the levels that we need to stop violence. I'm going to talk a little bit about gender-based violence, but it's actually the easiest thing to get a 50% reduction because it's mostly what you can do in schools and universities and colleges. And it doesn't have a high cost. You do have a cost because you have to train the people to do it. You have to persuade the universities and colleges to make it compulsory for everybody, not just the people who would like to take it. And you need to measure. And we have Canadian tools for measuring sexual violence in schools and in universities, but we're not using them. So I could go on about parenting, and I can talk a little bit about reorienting policing, which is basically going back to Bob Lunny. And yes, with the current chief here, he's certainly about change too, and there are some good programs, the HELP program, for instance, in Edmonton. So I love the UN Sustainable Development Goals because they're about outcomes. So gender equality is about stopping violence against women, and it's about outcomes. Yes, you have to do things, but it's about outcomes. When we talk about crime, we don't talk about outcomes. We may talk about the clearance rate, but we don't talk about whether it's actually made a difference to levels of violence. And I am about things that make a difference to levels of violence. 16 has two goals. One is reducing significantly homicides and street violence, and it also has one about violence against children. So the 50% is my way of measuring significantly. They actually talk about eliminating some of these things. But I'm happy with 50%, and I think 50% is achievable, and I'm going to show you why. So yes, this makes me cry. There was a task force. It did its homework. It made recommendations. There was an election. $500 million promised for tough on causes, tough on crime, and some more police, but also more prevention and some intervention, that sort of rehabilitation and those sorts of things. It was more than that. They did it. You did it for 3 years. It then became permanent. They started with 5 ministries. They ended up with 9 ministries, and there was a sort of tithing process. And then suddenly, one day, it disappeared. And the main lesson, in my view, was they did everything right. They did the science right, but they didn't follow the secrets. And the secrets mean you have to demonstrate results. You have to measure outcomes. And you have to demonstrate that you are saving money, that you are, for me, saving lives, stopping injuries, stopping trauma. And you have to work with the constituencies. And those constituencies may include mothers, they may include others. So yes, violence is gradually increasing. These are Canadian data, rate per 100,000. People are arguing in Toronto during the mayor debate, is it really increasing in Toronto? Well, it depends what you look at, and of course it's police data, and police data are useful, but they don't tell the whole story. But in most other cities, it's gradually increasing. So Winnipeg, for instance, had 6 per 100,000 homicides last year. That makes it about the same level as Glasgow that I'm about to talk about. But hey, you know, 6 per 100,000, New York has more than 6 per 100,000. Chicago, and I'm going to talk about that soon, 6 per 100,000, they can't even see that. They can't imagine anything that low. Police costs have gone up. They went up mostly between 2000 and 2010, and they've been pretty steady if you account for inflation since then. But as Michael said, policing is an expensive resource, and we need policing, but we don't need policing where it's not needed. And we don't need policing if you've actually reduced violence. That does reduce the the workload. But there's no doubt that we need policing. But we need to be perhaps a bit more careful than we were 20 years ago about how we, the amount we spend on that. I'm not going to explain this, but it basically is done by the Globe and Mail, and it basically shows that we've done more to increase policing than we've done for the housing and social and family services. But the budgets for housing and social and family services are way bigger nationally than the 18 billion that we're now spending on policing. I'm going to talk about Chicago and Toronto, but if you want to, you can talk about New York and London. But Chicago and Toronto, it's more obvious. So you probably don't know, but Toronto is the third largest city in North America, and people are moving into Toronto. And in Chicago, they're moving out. So now Toronto is a bit bigger than Chicago. I can't prove to you that it's because of violence, but there is certainly a hypothesis that it's in part due to violence. So Chicago has 13,000 positions. They can't fill all the positions, so it's about 12,000. And Toronto has 5,500. There may be some of those that aren't filled. I'm not up to date on the exact numbers. Incarceration rate, that's the number of people in prison behind bars on an average day. And as you know, the United States is the prison capital of the world. It spends over $80 billion a year just on incarceration. And if you did it on a per capita basis, Germany or Canada are spending around 10 or 15 billion. So they have this incredible annual expenditures in incarceration. And despite that, the homicide rates in Chicago are more than 10 times those of Toronto. Now those vary a little bit from year to year. Toronto's gone down a little bit, but then it goes up other years, so it's around 70. So whether it's 65 or even it's been as high as 90 when the van murders took place. But hey, if it was more policing and more incarceration that made you safe, then the US cities would be the safest in the world, and they are very definitely not. And yes, one of the reasons why Toronto has lower violence is because we have a social safety net. Why did homicides not surge in Canada during COVID? Because we had CERB. But we have universal Medicare. We have schools that are mixed. We have a safety net. And all these things are well known to keep violence down. So I'm generally in favor of the long-term policies in social development, but I'm going to explain that in order to get short-term results, you have to look elsewhere. This is just an age curve of offenders in Canada. Basically, they peak around 18, and they fall off gradually. People often talk about 28, but you can see that it's just on a continuum. And yeah, so that's the age of offenders. StatsCan in 2010, I'm sorry, it hasn't changed, but I can't prove it to you because StatsCan doesn't provide that data. This is actually from Scotland, and you'll notice the curve is the same. This actually shows the blue or mauve are the people from disadvantaged areas. So it's the same age range, but there's a huge difference between the victims who come from poor areas versus the more affluent people. The curve that you can't see is women. So we also know from studies a lot about persistent offenders. Persistent offenders are your new premier wants to stop persistent offenders reoffending. And I'm going to show you how you stop persistent offenders reoffending, and it's basically that you get upstream before they get into the system. And one of that is that we know about a small group of offenders coming from poor areas, and that's what these studies do, and we know the characteristics. So yeah, born into relative poverty with housing problems. There was violence in the home. That's what inconsistent parenting means. They have cognitive difficulties, and I'm going to talk about that. They have problems in primary school, and they drop out from school, or they get dropped out, and they're frequently unemployed. These are very well known and very strongly established, but we don't do anything about them. So I'm sorry that this is for Winnipeg, but the graphs are better for Winnipeg than for Edmonton. And you'll notice it's 2001. These are Stats Can. So what you see in Winnipeg, in those blue areas, is the concentration of violence. And you can see this for Edmonton too. This is violent crime recorded by the police. And the yellow basically are high crime areas, so the blue, and the red are lower crime areas. And what you see is government transfers. That means poverty. They don't complete high school. Unemployed, median household, percent Aboriginal. So you can't change this within 3 years. Maybe you should, but no government can change those determinants of violence. So this is not the way to achieve a 3-year reduction. So I mentioned the 5% accounting for 55%. Victims are the same. Victimization is very concentrated. Sorry, it's a transition. And the police know about this because if they're doing hotspot policing, then they concentrate on hotspot policing, where you've got a concentration of offenders and victims. Now, this is very important that a small group account for a lot of crime that happens. So your current police chief helped develop this chart. And this is a chart used by the Ontario government because every municipality in Ontario has to develop a community safety and well-being plan. By the way, I don't like those long phrases. I would like a violence prevention and community safety plan, but we can talk about that later. Now, the red is what we're doing at the moment. Police response, ambulance response, healthcare response, and other responses. And help is in the yellow category, so where somebody's come to the attention of the police, it might lead to an arrest, then you're trying to refer them to a service that can help them. Of course, the catch is those services aren't always available, but the help program here is a good way of doing that. And I want to just hop to the green. The green is if you were going to eliminate poverty, if you were going to provide a guaranteed minimum income, if you were going to eliminate racism. You need to do all those things, and governments are doing them, and not just because they reduce violence, for other reasons, and they need to continue doing them. The blue is what's important. This is where you can focus services that will actually reduce violence within a 3-year period. Now, you need to be aware that policing is not the only source of information. In fact, in Canada, the proportion of victims who go to the police has been dropping. So in 93, it was around 42%, and this only goes to 2009, but if you go to 2019, it has not gone above that 30% level. This means that you have to use other sources than policing. You use policing, but not only policing. This shows you, if you go from the General Social Survey, so the 1 in 15 that you saw in the slide, in the video, it's actually closer to 1 in 12. That's everybody who's been a victim of violence, typically an assault of some sort, but it could be more than an assault. So only some of that is reported to the police, and the police don't record everything for a variety of reasons. They probably record the more serious ones, and then you get clear up, and then you get offender convicted. So even if the police is very efficient And of course, this doesn't show you repeat offending. You were only going to move through the system a certain proportion. So now, the solid science. Solid science. You're going to see a bunch of websites, and these websites show you where I had to go to do an encyclopedic analysis of everything that works. So that's the POP site in the US, Crime Solutions in the US government. This is one on violence against women, World Health Organization. This for Michael is on cost benefit, and this is the WHO. So what I did in the book was bring all this together and more, and explain it to decision makers so that they know what works. A lot of the stuff that works has been done as a random controlled trial. So you take a bunch of 100 kids and you give them enriched childcare to 50 and not to the other 50, and you see whether there's any change in prevention. That's how you do medical experiments, and there are a lot of those. Some of them are before and after. So you look at involvement with police before, and then you look at involvement with police afterwards. But there are also a lot of commissions. This is not one or two academics. These are very large bodies of data that are brought together, and then I tried to make it simple so that people could understand. So this is really looking from a police perspective. If you're looking at property crime, then situational crime prevention is very effective. It gives a $4 return on every dollar, but actually it gives more. This is things like having sensors on your front door, or using locks, or designing parking so that it's unlikely that people would see. These are worth doing. But for property crime, it's very hard to use these. There are some things you can do, but it's very hard to use these for violence. Diversion is basically what Dale McPhee is known for, and that is that when a police officer is making an arrest, instead of taking that person to the lockup, you take them to a service for alcoholics, or for indigenous, or for schools, or whatever. Using cautioning, which is a British invention, is a way of, instead of allowing the person to move through the system, you caution them. And cautioning can also involve actually some help for the person. Focused deterrence is very fashionable in the United States. The police researchers in the US just love this. They claim that the Boston Miracle in the mid-90s that reduced shootings and homicides by something like 60% within a year was due to focused deterrence. I actually don't agree. I was looking at that very closely when it happened. And yes, having police push people towards outreach workers is an important role for police. But when they don't go to the worker, they go through a system that basically writes them off. So I've been looking at what Montreal can do, and they want to adopt focused deterrence. And I'm very cautious about focused deterrence because you're going to focus on racialized and indigenous people, and some of it will push them to those outreach workers, but not all of it. Hotspots policing, well known to work. Stop and frisk, not. So I'm a victim guy, so I had to have one slide on what Bob Lunny got to invent, by the way, in 1979. I was at the museum this morning with my wife, and we were talking about the Robert Lunny Street, and we were talking about what Robert Lunny did, and he made victims and first in aid for victims a priority. And basically what that meant was you gave victims information, You have to deal differently with the needs of women and children. There's a training strategy that was invented by an organization in the US and by the International Association of Chiefs of Police. So there are lots of things we can do, and you need to survey whether those are happening. And yes, we have a Bill of Rights for victims in Canada, but we have no idea whether anybody actually gets those rights. So on to prevention. So one of my favorites is the Youth Inclusion Program, 65% reduction in youth arrests. Hello, 65% reduction in youth arrests. Is that worth doing in Edmonton? Yes, it's worth doing. Now you already have wraparound, and I'm not quite sure how they overlap, so you may not want to adopt something new. You may be able to build on that. But I'm going to talk about Glasgow. Glasgow used youth inclusion. That's how they got 50% reduction within 3 years. Why does Montreal have fewer homicides than Toronto? I have no idea. But my theory is that in the 90s, Montreal put youth centers in the areas of poverty, and the folk working in those youth centers looked like the people in the areas of poverty, and what they were doing were outreaching to young men. Ottawa, boring Ottawa, had a youth center in an old fire station run by a guy called Claude Turgeon, who some of you know in the audience and is a buddy of mine. And the police put it there, and then they gave it to the Boys and Girls Club. And basically what it was opposite an area where there were lots of shootings and drug dealing. And Claude, very charismatic guy, got them to come in and play baseball and finish their homework. And he was basically an outreach worker. And of course, they didn't evaluate it. They should have evaluated, but when the Brits evaluated, you got these important results. I'm a big fan of stuff in hospitals. Somebody comes in with stab wounds or shooting or just beaten up, and that's a critical time to have a social worker in helping them. And I can't prove to you that for domestic violence victims who go, or sexual assault victims who go to hospital emergency rooms, that you can actually help them. The evidence isn't there, but logically that should also work. And it clearly works for victims of violence. By the way, that is funded out of VOCA. Biden approved VOCA in '84, and I was part of the US organization that lobbied for VOCA. It's the Victims of Crime Act, and it takes money from pharmaceutical companies who now produce vaccines but cheat, and it takes banks who cheat, and so you get billions of dollars fines, and this goes to victim assistance. And I don't know whether you should be doing that in Edmonton, but there's at least logical in the US. So I said I would talk about SNAP. I think you may have a SNAP project here, but if you don't, you should have several. You should have enough SNAP projects. You should have enough YIP projects to reach 1,000 young men in that at-risk group. You should have enough SNAP projects to reach 1,000 young boys before they reach the age of 13. And this gives you a 33% reduction. Disappointing, not 50%, but hey, 33%. And then if you look at the return on the dollar analyzed by the Center for Disease Control, the US has told us that SNAP works. And basically what it is you take young boys and you help them to think through what they're going to do about conflict, and you see quite dramatic changes in those boys that last as they go through their teenage years. Parenting, I happen to be a fan of Triple P because it has a special group for youth at risk. This doesn't give you immediate results. Yes, you reduce child abuse, but it takes longer to reduce violence. So this is taken from Public Safety Canada, and this is for Michael. This shows you If you invest in SNAP before, this talks about 6 to 10, and then you do YIP, the federal government likes YIP, 11 to 14, and then you do a family treatment in the 15 to 17 years. This shows you how much you would save notionally in policing costs and prison costs. And hey, that's important. But what it doesn't show you is just how many of these young people had a positive life experience. This is investing in the futures of these young people, and this doesn't show you how many people were not admitted to hospitals because of injuries, or were there with trauma that is low visibility and led to their own offending, as one of the specialists in the audience tonight was telling me before we started this. So this is a safety monitor tool that we developed for people like Michael and the mayor, and this is a sort of checklist. Has your city looked at these things that worked? And by the way, has it also done the logic test for things that don't work? Often the most popular things don't work. DARE was an LAPD program to teach people not to use drugs, and it actually marginally increased the use of drugs. So you have to avoid these things that don't work. Now, it talks about things like reducing harmful effects of the justice process, whether you do that through cautioning or whether you do it through the Dalement fee hubs. You have to worry about alcohol and firearms and knives. You have to worry about hotspots. And I'm not totally against focused deterrence, but only if you do it like Glasgow did it and not the American way. So now we're on to secrets. Secrets require planning. Any for-profit company in this wonderful province does something like this. They look at what they're going to do, they develop a business plan, they implement it, and they evaluate it. Well, that's how you reduce violence. You look at what's missing, the safety diagnosis. You come up with a plan as to how you're going to make it work, and you implement it. Implementation is often overlooked, and evaluation is almost always overlooked. And evaluation doesn't shut these things down. It's a loop. So you have to do this. Whoops. So we've also developed a safety monitor tool that lists the things that you need to do. And this is too many things for you to grasp, but you notice in there you have to have a lead unit doing this. Probably something like REACH Edmonton. You have to have the planning. You have to look at how you can mobilize different sectors. You have to come up with an adequate budget and not just projects, which is what the federal government does. You do something neat for 3 years. I'm not sure if Kim Bowden is in the audience, but if you look at RAGS, the Regina Anti-Gang Strategy, wow, amazing success. It works. We reduce gang violence. Where did it go? Where did it go? Because the money ran out at the end of the project, and ultimately those people who were working began to look for other projects. So you have to have sustained funding, and the federal government has to lead on that sustained funding. It also talks about training the people. The federal government could easily be paying for training. The Canadian Municipal Network for Crime Prevention does this on the side of their desk, and they're good at it. But it needs to be properly funded so that we change, like Andrea said, change, so we actually have a culture of people who know how to do community safety planning. The stuff in red is about outcomes. You have to measure outcomes, and you have to set targets. So Bogota, why would anybody talk about Bogota? Well, Bogota did it right in the 90s. That's a 50% reduction over 10 years. And the way they did it was an Office for Violence Prevention and doing the things. They wanted to control alcohol. They wanted to remove handguns. And they wanted to do the stuff in hospital emergencies. So they were already doing some of the things that are known to work. Glasgow. So where did the idea for Glasgow come from? Bogota. I watched Carnochan, who your chief of police is a fan of. He was a senior police officer in the police for Glasgow, Strathclyde, and he listened to the guy from Bogota, and he said, I'm going to do that in Glasgow. So he had to hire a public health person, a woman, who was an expert on how you do epidemiology analyses relating to crime. And 2 years later, they started doing the things and they got a 50% reduction. Hey, you can do that in Edmonton. You can do that in Alberta. Yes, you can do that in Alberta with your current premier, in my view. Tough on crime means reducing crime and not just waiting until you have persistent offenders persistently offending. The people who vote for doing something about crime don't know that you can stop it before it happens, so you have to tell them about it. Now, Glasgow is now being replicated across the United Kingdom. Guess what? It's a conservative government. Some people think a crazy government in England. But they have some good sense. And the good sense is they listen to a task force, like you had in Alberta 15 years ago, that said, hey, the first thing you need to do is establish an office for violence reduction. And yes, you need to do youth outreach. And yes, you need to do something about what happens in schools. And yes, you need to do something about alcohol and drugs. There are actually 6 recommendations. So those have been taken up. So the Mayor of London, tough on causes, tough on crime, increasing police budgets, which actually were cut by 20% by the Conservatives earlier. So he's not eliminating the police, but he has set up an office for violence reduction headed by a woman, senior, successful city councillor, with more than Glasgow had, because London's bigger than Glasgow. Glasgow's about 600,000, same size as Winnipeg. London is about 8 million, without talking about people who come in during the day. So he set up an office, and he's mentoring to scale. Thousands of young men are being mentored. He's doing cognitive behavioral therapy. I wish he'd do SNAP, but the American one is cognitive behavioral therapy. It's good. It's worth doing. He's also doing some things to reduce poverty and racism. So he's doing both of those things. But to get short-term results, it's things like mentoring, sports with mentoring, cognitive behavioral therapy. The Mayor of Toronto is required to, well, the City of Toronto is required in their Police Act, and I believe you're going to get a Police Act that requires community safety and well-being plans. I do not like these plans because I'm about victimization. It's good to work on homelessness. It's good to work on the mentally ill. But when you are trying to do all these things at the same time, you don't deal with what I want you to deal with. Now, I know other people want you to deal with homelessness. Go for it. But if you want to reduce crime, then listen to what the evidence says. They have already spent $12 million on replicating an Edmonton, a REACH Edmonton invention, 24/7 crisis. So this is not police responding to mental wellness checks. These are mental health professionals. They've done 2 regional projects that I think are going to 4. One of those is focused on Indigenous, and basically, you don't need to call the police in. I don't know the exact numbers, but it's rare that they call the police in. And this is, of course, like Cahoots, the American thing, so they get all the Hollywood stuff, and Edmonton quietly does this really well. and probably not funded well enough so that you can do it across the board. But this is what you need to do. And there's no doubt that the best way to do it is how you're already doing it in Edmonton. Yeah, you can have police social workers, that's more moderate, but you get problems when you have a police officer going in with a social worker because some of the mentally illness cases react to the police officer. It's not that the police officer is necessarily bad intrinsically. So they're also spent $1 million on planning the governance. That's the Office for Violence Reduction, $1 million. Now, I'm waiting to see what they've recommended, and I don't know why it's taking so long. I'm sure you can do this faster here, but you already have an agency that they don't need to, REACH Edmonton, they don't need to look elsewhere. So we'll see what goes on. And I think the mayor election in Toronto is going to determine whether Toronto has the current levels of violence and increasing violence, or whether they actually see reductions. So, hey, I have to be nice to the Americans somewhere. And the mayor of Boston in April promised a 20% reduction in shootings and homicide within the next 3 years. Now, I think she's a smart politician because she looked at evidence that she could reduce it by 50%, and she promised 20%. Under-promise, overachieve. Why? Sorry, it's my popcorn. How is she confident? Because she's looked at the evidence of what works. She did a 3-day project bringing in experts and helped show her what could be achieved. And you did that some time ago, but you need to do it up to date now because there's so much more solid evidence. And I think this is one of the ways, and more up to date. You maybe don't need a task force, but you need to share with the public, as the mayor of Boston did, what we know that works, and she'll achieve it. Mayor of Newark, probably of less interest to you, but they, maybe to people in the front row, it's called Violence Reduction and Trauma Recovery, so it has a special focus on trauma. Toronto also has a special focus on trauma, but I don't think they've really thought it through. So what is possible? I think it's really important to understand that policing is part of the Canadian culture. It's not an accident that we have an icon of a police officer. We believe in law and order. We believe in policing. We generally have confidence in policing. Now, the people who don't have confidence in policing are people who get arrested, or people who get over-focused on, or actually victims. That's why I mentioned earlier on. But if you aren't actually having contact, you want the police. You want somebody who's able to respond to 911. So what we have to do, but when you call 911, the problem's happened. So you have to get upstream from that. Actually, if you look at surveys about future funding as opposed to back funding, the public in most countries is generally in favor of prevention without really knowing the things that can work. And in Alberta, you find in around 2005 when they did focused deterrence, and you see also in surveys today in Canada, the public does not have confidence in courts and prisons. They do have confidence in policing, although it's not universal. So some of the secrets is we have to work with the people who want these changes, and these can be general public, also people affected by crime. We need to get the science and secrets out there. There was a petition, there have been op-eds in a number of media newspapers in Ontario and Quebec. People know about the Glasgow story because there have been special stories about Glasgow in the Montreal Gazette, in the La Presse. the Star has been talking about doing a story. It hasn't come out yet. We have the Canadian Municipal Networks has these wonderful action briefs that are just not being used. We also have a lot of things that Michael can use because he's such a whiz on social media. The 2-minute program that you saw here. There's a thing on adverse child experiences. There's a TEDx talk. And actually in the handout, you have some other, if you're into social media, there's some other social media things that you can use. But you basically just need to follow Michael. He's absolutely amazing on his knowledge on this area. So my conclusion is, think about accelerators. These are not expensive, but we need them. We need to train those people who do the planning. We need to develop data, new data, things that StatsCan can do and that can be used in hospitals and can be used in schools, universities, and colleges. We need to raise awareness. And I've done a short list of 5 things that we can immediately invest in. And the neat thing about these 5 things is that they're all on the Public Safety Canada website. So although they're on a lot of other websites that has actually done more work than our Public Safety Canada, and Public Safety Canada is funding projects for 70 to 100 kids when they should be putting sustained money into 2,000 to 3,000 kids, or whatever the number is in Edmonton. So with that, just to quote, for the harm done by the offender, it's normally he is accountable. But for the harm done because we do not use the science and secrets that are available to us, we are responsible. So I hope you can go away with a passion to get the City of Edmonton, the Province of Alberta, and Canada to move, to invest in the accelerators that will give us a culture of reducing violence significantly, and invest in a sustained and adequate way in delivering those to enough young boys and young men so that our world is safer from gangs and guns and safer from intimate partner and sexual violence. So thank you for listening. I probably went over time, but I can't speak as fast as you, Michael.